Welcome back to another episode of Rags to Riches, The Refined Mind. And we have another special Natalia.
Hey guys.
Didn't ding.
Diana.
And
Megan.
welcome back, Meg. Had to bring her back. No, it's been some really, really good conversations. And I kind of want to just go straight in because I think you mentioned in the other episode some heartfelt conversations. I was getting a bit teary. So I have kind of put a bit of tissue in my back pocket. I'm an emotional being anyway. So you touched on some of the things that you experienced, Diana, like the miscarriage you mentioned.
Yeah, that was a shock. So, a little bit about my health. Obviously, I had fibroids at the time, and I had a very, very large one. And then from going to the smear test that you're supposed to take every 5 years, I had a smear test. And the most recent one that I had at the time, the nurse told me that my cervix was like a certain way, so I would have to work extra hard on top of like having the fibroids. And then I had an autoimmune condition, Graves' disease, thyroid. So all of this combined through advice of the doctors and nurses, they had informed me that I wouldn't be able to have children, or it wouldn't be easy. Obviously, I didn't think that would be like my story, but I just didn't expect to get pregnant at the time. And so when I did, it was a shock. It was a surprise, but it was a very like pleasant surprise because I was just like, wow, I can have babies.
Especially after
being told you can't.
After being told I can't. And I think my smear test was literally like maybe like 2-3 months before that. And so obviously when they had told me that, then I was just like, I'm going to have to work extra hard. I remember the auntie, the nurse, sorry, I call her auntie, but she was even giving me positions that you have to do.
Oh, you mean as in working hard to conceive?
To conceive.
Right.
From my
Those
cervix
aunties, they
yeah, she was even giving me positions and everything. So she was like, you're going to have to really try hard. And obviously because of the age, she was like, you're going to have to try harder. It's not going to be easy and stuff like that. So I was like, okay, cool. So it was a pleasant surprise. And I was like, okay, God, like, what happened? And then I remember, like, I think Jay, you were the first person I actually told. I was really like, early stage. I found out quite early, so I didn't want to tell anybody.
Of course, because they always say like after, is it 12 weeks or something like that? Then you can tell.
Yeah, and with the fibroids and everything, I was just like, let me just make sure everything's okay. I remember speaking to you about it, and then I just started to grow like a lot of like anxiety, but I was trying to like keep myself grounded and like take away the negative thoughts, and I
have faith.
Yeah, and have faith. And then obviously I've got my friends that were mothers already, and so I remember Jay was just like, we've got a group chat, and Jay was like, do you know what, I think it will be okay, like if you like tell the girls, so we can have that support and we can pray and have like conversations. So I remember telling you guys, I can't remember how far along I was, but at the time, and then I just remember, because I have fibroids, it's like when your fibroids degenerate, which means it shrinks, it causes a lot of pain, and also when you are high in estrogen, it feeds off of that and causes a lot of pain. So there was a time during the pregnancy I was in a lot of pain. I had gone to the hospital, and obviously because I was pregnant, they checked the vitality of the baby. The baby's heartbeat was fine and everything, and I think maybe the weekend after, so it was probably a few days, I started to spot.
It's not a good sign, is it?
Yeah, I started to spot, and so I called them up, and I was just like, I'm spotting, and they were like, no, it's fine. They were like, is it a lot? And I was just like, no. They were like, no, it's fine, it's fine.
The thing with the anxiety as well, like
it really induced so much anxiety. Like I started to like really panic. I obviously told you guys, and you guys were like kind of like, what color is it? Because that all matters.
Because you got the normal part, and then the abnormal bit.
Yeah, and I think there's something to be said about the healthcare system and how they deal with. I know everybody, they're probably used to dealing with a lot of like first-time mothers and stuff like that, but I think they lose their sensitivity
100%
to how they deal with you, and they forget that this is your first time. I know it's not yours, but it's my first time. And so it's kind of like, they shrugged me off and like, wouldn't even offer to like maybe see me or something.
And the thing is, you know your body, like
I know my body.
Everything that you're going through.
Yeah.
If the pain is different, this isn't just normal. This is something's wrong.
Yeah. And so I just remember that time, it really like messed with me a little bit for a while, because I was just like, okay, over this weekend, it was a weekend when I'd called them, I think it was on a Friday, I was just like, I'm just going to declare over my womb, like use my faith, shut out the noise and just speak over my womb. And then I remember the blood just started to come more. And I was just like, no, something's not right. The hospital wouldn't see me, so I ended up just booking a private appointment at a clinic for the Monday. And when I went in, obviously I got the news. The most traumatic thing I think I had experienced at that time, it's usually just a story, and you hear like so many women go through it. But you don't actually understand the process
until you go through it.
And I remember the nurse when she was even checking, because it was like literally like my womb and the baby. Oh God, that is rough. On the screen, and you can like just see like the baby floating, and it was almost like the nurse really wanted to find a heartbeat for me. You could tell that she just didn't want this to be the news. So that happened, and the baby died, and I was so confused and conflicted, because I was just like, the heart rate was fine. So what changed? Like literally, what changed? Like between then and like a few days later.
I think people forget that childbearing is a miracle.
Yes,
it's a miracle. It almost looks as if it's a miracle in its own. Like like G, as you always remember, G would have been a twin. But I lost the second about just before 12 weeks as well. So I would have had twins. But like you're saying, it's like one of those things, because it's almost like they have a standardized, okay, what's happening? We can't really do anything. We just let the body do what it's
I didn't know what to expect. It's like you go through two traumas. Because it's like you first see that the baby's dead, and then you go through a pain. I did not know the process.
Because there's still something in you.
So your body's contracting the baby out. I did not know. So I remember even my friend came over, one of my good friends came over to kind of just like look after me, because I was in pain. I wasn't eating. Obviously, I was like really, really sad at the time. And then the day she had left, I went to use the bathroom. She left like 10 minutes later. And then the baby plopped out. I was like, that was another trauma. I started screaming. And I was like, on the phone to her. She rushed right back in a taxi. But no one really tells you like the process that you go through. And even when I had lost the baby, I called the hospital. They didn't even update their records on time. And so they were still sending me like my midwife appointments, and I was just like, it was just a lot of trauma. I was just like,
it's almost like arrows coming left, right.
And working in the health sector is one of those things, depending on where you'd have gone, because our systems are different. Each hospital uses, so if you probably go to A&E, they probably use maybe like what they call system 1, and then you probably come maybe to our side, we use a different system. So then it won't update ours until the letter comes over from where you went.
It's weird that I learned that the hard way.
Exactly. It's like, oh my goodness.
Because it's very frustrating.
Different systems in the hospital.
Because you think like, why the system's not talking to each other?
Because it's not the same
it's not
software.
The same.
Almost every hospital doesn't use the same software. Most hospitals use different software, so that's a problem.
But then at the same time, it's communicate that to the person, like let them know like what's happening. And it's that what you're saying is like they just get so desensitized and so detached, like that human element, like they treat you like
it becomes a job for them.
It becomes a job for them.
So it's different when you could meet somebody, probably they've gone through it themselves and they're a bit more compassionate. So let's say, for example, that nurse probably she's gone through it herself and she's trying so hard to make sure that everything's okay for you. But then you meet someone on the 111 call and you're telling them that your symptoms are like...
They just shut down,
My sister went through exactly the same thing. I understand.
Sorry to hear you went through that.
So let's just let the body do what it wanted to do.
No.
So then there is like saying there's no follow-up, there's nothing.
There's no follow-up because I didn't know what to do. I was like, should I
Mm.
come in? Like, do I need to book an appointment to come in? Like, how does the baby come out? Like, is it just going to stay there?
Yeah.
So I was just like, no, you don't need to. Like, I just did not know what to expect. So
Did they ever like say what potentially caused
No.
the miscarriage?
The lady, even on the phone, the medic on the phone, she was just like, it's usually if you're like maybe a little bit more far gone.
Okay.
So I think I was 10 weeks
Yeah.
at the time. But if you're a little bit more far gone, that's when they kind of like...
Okay,
you
they
know,
can do
Oh,
more.
dissect it a
Yeah.
little bit more and stuff, because I was like, is it my medication?
Mhm.
But they were like, no, it's not your medication. I was just like, you gave me this, the painkillers. They were like, no.
Yeah, I can't remember for lack of... don't quote me on this, but I'm pretty sure I think before the 12-week period, they can't really do anything really. I don't think they can do anything. Like you're saying, if you're far gone, they probably say things like bed rest, you're not allowed to get out of bed because you're far gone or something. I think there's stages and like in childbearing.
Medically,
Medically they can do something and then at some point they can't really do it. They can't, they cannot do something.
That's tough.
It is tough.
And like with the fibroid, because you said that it shrunk, was that because of the pregnancy that it shrunk, or was that because of the medication?
Almost like, the baby, when you're pregnant, you produce a lot more estrogen and your blood, so it's like they're fighting for that space.
Yeah.
And I had a really big, I think mine was like 9 centimeters, but then I had many others as well, and my womb was infested with them. So it's like the baby, which in the first scan they were like, it's not really touching the child. So the child's fine.
So they keep scanning and
keeping an eye. But I mean, me personally, I feel like there's a lot more to the story outside of it, spiritually speaking and stuff like that. So I feel like it could have been that had played a factor. But on the positive though, like because I did have the miscarriage, they sped up the process and they started to treat the fibroid situation a lot more serious.
Yeah.
Whereas before, I was diagnosed.
You just like
2018, they kept on putting me on the system to go to the clinic and get treated. And every time I would have, I think a new one would grow every like 3 months. It was growing rapidly. And when I go in, they were like, oh, we don't know why we haven't been referred to the clinic yet, but I can see your name's on the system.
And like so many women like go through like that. There's so many like health issues like women go through, and something that you're saying like childbearing is a miracle, and I think people don't realize it. And especially when you're younger, like you might have like what's it called? Not miscarriage. When you get rid of it, abortion, yeah. So like you might be like, oh yeah, I'm just gonna abort, and then I'll conceive when I'm ready. And then when it gets to the age, it's like you're trying, nothing is
and
happening.
you start blaming the aunties of the family,
and
the devil of the family.
And you even probably blame yourself as well. You start thinking, oh my goodness, all the time that I had a baby and I
had the opportunity,
and you start going through that whole phase of your life again, now regretting all of those things.
It's so interesting because I feel like our bodies are created to have children quite young. I have a theory. It's not like proven, but I just feel like if our wombs are left empty, I feel like our hormones start to like produce different things. Because even with like all these autoimmune diseases, like even with the most recent one, I was diagnosed with the consultant was literally like, if you have a baby, this will literally go away.
It's interesting. There's a lot of things.
When it comes to women health, they always say if you have a baby, it will sort itself.
Maybe that's why it's a miracle. Like it's like conceiving is not just to bring joy and just bring a child into this world. It actually brings a lot of healing into our bodies. Like I know, like with one of my friends, like her when she had a child, it literally like cleared her skin like so well. And even like with me, because I had a thing called ascites, is where basically like fluid like just builds up like inside of you, but it can come from endometriosis. It's very rare. And when I had my child, it literally took so much of the fluid away. So it's like, yeah, exactly. Like when God kind of like
God does
reconstructs
not make
these things,
He's like, this
you
makes
know.
I
sense.
never understand all of this, isn't it? Because I had like since starting my period, like I started very early. I think I was about maybe 10, 11 or something like that. I used to be 2 weeks on, 2 weeks off, 2 weeks on.
Yeah,
That
and
was
your
my life.
bleeding was
It was
heavy.
ridiculous. It was 2 weeks on, 2 weeks off. And then I think there was one point I was here in Northampton, was the days when I lived here. At that time, I remember it was getting worse to the point of I could be wearing a super plus and a night pad, and I've been literally dripping through within 2 hours throughout my legs. That's how terrible this was.
The
and then you go to the
issue
gym.
of blood.
I was literally, I just needed a bell. It's just like then unclean coming through. But then
You're so silly.
honestly,
Not unclean coming through.
you know,
That's a lot.
you know, like you're going to go and buy your feminine stuff, as if like you're buying bread and milk. You know what I mean?
Crazy.
It became a norm and stuff like that.
It's just not normal.
And if you go to the GP, they say, "Oh, it's just your hormones. It's just changing." I'm just thinking, how
It's
is
so
this normal?
tough.
Because this is affecting my life. And it's one of those like, okay, girls, I'm just about to get up. Can somebody just stand behind me?
Yeah, one of those
Especially in the
ones.
crowd, right? Can someone stand behind me? Let's make sure I'm good.
Just check.
Right? It was
You
so
just get on
terrible.
with it. I remember when I
Or
started
you don't even want to go anywhere.
maternity pads. I started using maternity pads
because
because the
it was
bleeding
so
just got out.
bad.
Just like, listen, put 2 on top of each other.
Listen.
It's
don't
like
even
women
wanna
go
go
through
anywhere.
like so much.
Exactly. But I
We
had
just
my
get-
daughter. That's
sorted
it.
it out.
I'm fine.
I think what it did to me, what pregnancy did to me, is I used to have very painful.
Oh, that's another one.
But
Yeah.
the good thing about it was it's gonna take me 2 days.
Yeah.
Oh,
And
so
then that's-
sure.
my bleeding is
But
like
then you'll be so
2
sick,
days, and then
throwing up and all sorts. You don't even
not
get
gonna
anywhere.
eat. I'll
Exactly.
Be moody, I'll be
Lying down in
extremely
bed.
sad.
But
And
you'll
then-
take that over the 5 to 7 days.
Yeah, but I had cousins who
Yeah.
go for a week.
Yeah.
No pain,
Nothing.
nothing for a week.
And
just
school
bleeding.
you when you're not coming into school.
Yeah. And I'm not
Oh.
gonna do anything.
Yeah.
Anything at all. I'm not gonna eat.
Oh my
I'll just, when you sweep the floor when it's cold.
Yeah.
Oh, that's my best thing. I'll just lay
Just
down
lie down
there.
there.
Everyone
Wow.
knew that this
Very
was going for
interesting.
something.
Yeah.
But when I had
Your own deliverance.
when I had my child,
Yeah.
that's it.
It's so, I don't even know,
That's
because
it.
I guess because we don't really know much about all of those things, but then it's so weird how it's connected that as soon as you have a child, it seems as if like the womb resets.
Yeah.
It's so weird. It's so weird.
It's
It just
really
brings
interesting.
healing.
all your, like, everything about you, even your blood, your
Yeah.
skin, your nails, your hair, everything resets.
Yeah.
And then a lot of women don't know that because we don't
We don't
have
ask
Yeah,
them
and I think
questions.
and I think as well, it's like because there's so much stress add on as well. So it's like you don't even get to that place where your body can reset. Like especially if you come from like maybe like you're a single parent or a single mum, it's like you don't have somebody to actually allow you to reset your body, like where you could rest.
Yeah.
Oh my god.
Because you need to rest.
Yeah.
But if you're constantly on the go, like when does your body have time to heal?
Not even just your body, your mind.
Your mind.
Your mind, because this is where you find that a lot of postnatal depression. Because, like, when you have a family or you got somebody to lean on when you've got a young child, they take the baby away from you, they
Yes.
feed the baby whilst you get time to rest.
Yes.
But when you don't have anything like that, can you imagine constantly crying baby, and you can't sleep as well. You haven't been
Yeah.
able to sleep. And
And then
it's-
don't forget postpartum.
that's
Yeah,
it,
that's what
exactly.
she's saying.
That's it.
And sometimes you can be with your partner can be there and he's useless.
Yeah.
As
No,
well.
it's true.
And also it's not their fault. Nobody taught
Because
them.
they don't understand exactly. So, because it's actually a conversation we had with one of the guys earlier on. We're talking about is that we talk about the family dynamics these days and
Yeah.
how relationships don't seem to work. And when you know that it's good for a child to grow up in a house with both a mother and a father,
Yeah.
but then unfortunately, things haven't been working out like that for our generation, especially. We're a generation, I believe that it's a generation that's so impatient, a generation that is unlearned when it comes to relationship, a generation that doesn't want to work
The
on
microwave.
anything at all. Microwave generation.
Yeah.
Like, you don't want to work on anything at all. You don't even know anything. But I know what I know. He knows what he knows. So from my perspective, he's wrong at every level. And then from his perspective, I am wrong at every level.
Do you know what? The thing that I don't get, is why some men, like, especially when it comes to, like, you've just given birth, but it's like they know everything. This is how you should hold to breastfeed the child.
What,
This is
men?
how, some men get like that. They even add to the stress.
What kind of man is that?
No, I have
This is
experienced
not
such.
Really?
It's like, I'm sorry, but I feel like, especially when you give birth, some things are, it's natural, it's maternal. And it's like sometimes they can also add that stress, but it's like what you're saying, they know what they know, and you know what you know.
So
and it's hard to come together.
Exactly. I think it's like I think parenthood is a learning curve for everybody. When you start realizing it's like, actually, you know, maybe I need to take the baby away from my wife, from my partner, just for 2 hours, like just go and rest, or just go out for fresh air. Don't worry about it. I got this, right? But then
you barely see that.
You know what I mean? It's because we don't understand one another.
That's the reason why here you see they have a lot of couple, like parenting couple,
like co-parenting,
expectant parents, courses. Because when you go to those courses, they teach you this is what you should be doing when your woman who's pregnant. This is happening to her. This is how you should, this is what you should do. This is what you learn, but none of our parents have.
But you have to want to
for us,
do
it's
that.
cultural, isn't it? But then an advantage for our culture normally is when you have a baby, you've got your moms, your aunties, everybody's there. Your aunties, everybody's there.
You have
so
neighbors.
all you do, you just wake up to feed the baby. Someone brings the baby to you to feed.
No, it's
Put your feet up. That's
you
it.
eat.
They bring food for you.
You eat. All you do is just come up, get up, go shower, eat, sleep, feed the baby.
And
that's
they
all.
take care
They
of
give you time. Exactly. They give you time for your mind, your body to heal.
You feel like you just gave birth to a kid.
I'm going back to Africa.
That's the difference. And then when we come here now, the men don't know how to function in that perspective, because in this side of the world, they don't know anything. Because if you're back home,
and the thing is, they have to be all of those things.
Exactly.
But if they haven't seen it, or
never
they
seen
don't know,
so they don't know how to do
so
it.
it's like, then it just brings conflict, and then they just want to like
because we've got an
retract and
expectation.
go out.
I am expecting you to help me out whilst I'm down, but I ain't got no clue that what this is taking a toll on my mind. This is taking a toll on just everything, your mind, your body, everything. And then
because it affects your body. It's like your body changes. And it's like you lose self-confidence. You know, you look at yourself in the mirror and it's like, oh.
No. Have you been showered? Or 2 second shower? 2 second shower whilst the baby's like, sleeping. Everybody
it's true.
Quick shower, quick food. You don't even, just take a bath. You know when you just put your candles on and just have a moment. Hey, you nobody got time for that. Someone needs your attention.
It is hard here. It is hard.
Yeah. And I think as well, like, even taking away, like, bearing a child, having like health issues, and then being in a relationship, again, something that we spoke about earlier, it's like when you have those conversations, this is my health, this is what it comes with, are you prepared, like what does that look like for a relationship, like are you, because I might have to go to the hospital, I don't know, like 3 times a month or something, because sometimes it gets like that, because you can have episodes where the pain hits you, like how is it going to handle that?
Exactly. Can you handle the would you be willing to research and find out how to help me whilst I'm going through what I'm going through?
I feel like that's quite difficult conversation for me, because like you were saying earlier, the finances is difficult, but for me it's the health. Because it feels like it's a burden.
It's personal, isn't it?
Yeah,
it's personal.
I've also been thinking about like my children and like thinking I need to have a healthy partner. I don't know if it's like fair for me to be like, I need my partner to be healthy.
Because
if I'm not healthy, but
unfortunately you have to start thinking
like
like
that like your kids are now like predisposed to. Do you get what I mean? Even though some things they say aren't hereditary, you can just never know. Do you get what I mean? Like they could still be at a higher risk if like maybe there's a stressor on their body might respond the same way, and you can never.
It's interesting. Do you feel like that takes an element out of like not genuinity, but like, because now when you think about a relationship, it's like, are you financially stable? Because you see what you've gone through, and like certain things matter now. Whereas like before, it's love, but now you realize that love is great,
but
love is important, but love is not going to. I think love is not sustainability.
It's not.
So it's like, it's again like those are you financially stable? Like again, like the health thing is like, it's kind of, you feel bad to think about it, but it's right to think about it.
And I think with age as well, like as you get older, it's almost like you are living this life, and it's now like to allow another person into my space, or to now like go into another person's space. It has to be worth it, and it has to be worth it, and it has to make sense. Does that make sense? Like,
are you worth my time?
That's true.
It's true. We're not wasted. Yeah.
What she means is when you've been single for a very long time, and then start dating,
it turns you.
It does, because you're so used
so
to
different
like,
person.
you are used to like,
your own
this is how I take care of myself.
Yeah.
You're now bringing another person into your life, or you're going into another person's life. Is this person going to be thoughtful?
Yeah.
Or am I exposing myself to more trauma and stress that I don't need?
Do you get, are you healed?
So I think it still stays genuine, but in terms of like the things that you look for now, because of the state that you're in, or the condition that you're in,
you're becoming a bit more meticulous with
about who. I need you to be considerate. If you're not a considerate person or a thoughtful person, and it could just be as simple as my laptop broke. Wait, no, guys, hear me out. Don't laugh. But it could be as simple as like, my laptop broke. Are you going to bring a solution, or you're just like, oh, that's too bad? Do you get what I mean? For me, it's just the thoughtfulness. Like, I've had guys that are amazing. I'm not saying buy me a new laptop, but
but bring a solution.
Where I was like, oh my god, my laptop kind of like just broke, just in conversation.
Because it's work as well.
And he literally didn't even tell me. He just sent me like a bunch of instructions, and he was like, do this, do this, do that.
Come on, man.
This is D for you. D wants a man with solution. Don't just
I need a solution.
Mate,
I need you to be thoughtful.
Because I've actually locked guys off.
Be a man. Don't just be a man by paper. Be a man in everything.
Be a human with solutions. Because if not,
the garden is doing. Can you get to the garden? Don't wait for me to tell you.
I love me a handyman.
You like a handyman?
No, but it's actually important.
There's a lot of things I can do on my own. Like, fixing stuff around the house. Because obviously I'm a single mom. So I'm not expecting like, oh, I'm a boyfriend. I ain't got no boyfriend. I dated 3 years after I had my baby. So I had to learn to do certain things on my own at home. Like, put a table together. Try to plug actually my washing machine. I plugged it myself.
I won't go that far.
Girl. And I bought a whole set of
a toolbox.
Yeah, toolbox. I have them.
I do have them.
I have so many things.
I know how to use. I'm actually quite handy, but I don't want to be. This is the. You see these nails?
When I get a man,
okay, this is what I want to do.
Everybody speak for themselves. Thank you. Because I will handle my own.
You don't have to even be able to do it, but I need proactiveness. Like I've been in. Listen, I'm not even trying to expose anybody, but like just from relationships that I've seen, like older relationships that I've seen, I'm like, I do not want that. Like,
of course,
like that's where like the door handle is broken and the man of the house is just walking up and down, and we're all catching up.
Like he doesn't live in that house.
And I'm like,
no,
if you can't fix it, can you call someone that can?
Oh my god! Yeah, I've seen it as well.
I'm just like, we're all scraping hurt ourselves.
He gets annoying.
And I'm like,
no, because why is he there?
Why are you here?
Or like the paint in the house is going yellow. And I said I'm going to paint it, but you've told me to wait, and you have not painted this. No, because it actually makes a difference. For me, it's more about the mindset. It's not even about the. It's like, what kind of mindset?
I'm done. No, but oh my god!
Oh my goodness!
Girl, I've seen some things. I'm just like,
it's not my portion.
It's not my portion. Is this not your house? You do not love this house.
Yeah.
You do not live here.
But you know what is so interesting? Because sometimes we see it's like the modern. What do they call them? The modern guy are like they're not very like hands on, but sometimes it's even like the old school.
The old school
technology wants to make everything easier.
I'm a big.
I don't think it's technology. I think it's the mindset.
It's the mindset. Those youngers are useless. I'm telling you, useless. Even to just check. I remember one day I was going to work.
Wait, hold it there. Hold that thought there. Because we're going to come back in the next episode. Thank you guys so much for this episode. Come back for the next one because we've got more laughs, clearly.
Oh, dear.
Are you okay there?
Why are you in this house, Olga?
It's true.
Girl.
What is your purpose in this house?